guys. So today we are going to be talking about cold and flu because it's the season where practically someone you know or yourself probably have it. So we're going to go into details like the symptoms, the treatment, anything that, we think you benefit from. So we'll start talking about it. Trudy, do you want to start?
So cold and flu. Cold and flu is something that is very common at the moment. It is winter, it is cold, hence the name cold. And what's happening is a lot of people are also catching COVID during the colder weather, during the colder months, i.e. now. So it is something that majority of people are going to get. So they'll either get cold or a flu or COVID. So if you have either of the three, honestly, you're not special. It is normal. It is very common at the moment. And what we'll do is we will basically just very in very simple terms, just talk about some of the things that people don't know, some of the myths about cold and flu, and just basically remedies and treatment. Things you can buy over the counter in the pharmacy, and when you should really see the doctor. So to start with, the common cold. This is just a simple infection of the nose and throat, and it is caused by viruses. And no, it is not treated by antibiotics. Symptoms are normally just normal cold and flu symptoms, blocked nose, runny nose, a sore throat, coughing. These are symptoms of a common cold. And normally you just ease these symptoms by resting, drinking plenty of water. I always say plenty of oranges because there's a lot of vitamin C in that, and that boosts your immune system. And of course, using decongestants if suitable. But Stephanie, so what is really the difference between the cold and flu? Like, what is the common cold and what is the flu? What is the major difference between the two?
So often, people really think cold and flu are the same, but they're not. They're different. So with like the cold, it's caused by like common viruses like coronavirus. This is not like the COVID-19. These are like the common coronaviruses like influenza. Like it's basically the common viruses that causes like the cold. Whereas the flu, this is when it's caused by the influenza, the actual influenza virus. So with the cold, you have like the mild symptoms. With the flu, you have the obviously more aggressive symptoms. And with the flu, it's very aggressive. So as Truda mentioned, with the cold, you will probably get like the nasal symptoms, such as like runny nose, blocked nose, maybe a few sneezing here and there. Whereas like with the cold, you have a lot more, like you may get fever, like body aches, muscle pains, you can't move. With the flu, it can turn to be a lot more complicated. So it can basically lead to some complications when not treated. And whereas with the cold, it normally goes away within like 2 weeks. So with the cold, you can take like simple paracetamol, ibuprofen, just to help you manage the symptoms. Like as Trudy said, take like vitamin C, like a steam inhalation, just to relieve yourself from those symptoms. And with the flu, it also takes about 2 weeks to go, but as I said, symptoms are more aggressive. If you have like asthma, for instance, flu may exacerbate your symptom and cause it may cause like asthma attacks and make your asthma a bit worse. That's why people are a lot more scared about the flu. With flu as well, it may lead to like complications such as like inflammation of like your heart, inflammation of your brain, inflammation of the muscles. So that like people may not take flu lightly. Like they may take flu lightly, thinking it's like a common cold, but you need to be able to differentiate this. With the with the flu, it's a lot more aggressive. Honestly, you will feel it in your body that no, this is not like a common cold, because sometimes you won't even be able to move. So the most important thing, if you have the common cold, just stay indoors. Try not to, get your symptoms worse. Do make yourself warm. It's quite important to do that. Don't resort to antibiotics, because, as I said, the cold and flu, they're caused by viruses. Antibiotics just work on bacterial infections. So some people tend to go to their GP saying, oh, they would like antibiotics. Really, the GPs may refuse, because it's not a bacterial infection, it's a viral infection. So that's something that we need to be able to differentiate. And just remember, if you have a cold, just give it some time, and hopefully it should resolve. Trudy, what is the most annoying thing about cold and flu? What do you find so annoying?
I have had a flu once in
Yeah.
my life. Once, and maybe never again. I don't want a flu, because I thought, well, I called my dad. I was in Bournemouth at the time. I called my dad and I said, Dad, I think I'm dying. My dying wish is you come get me. I don't want to die alone. It was terrible. I was in my early 20s. I was panicking. I was not a full-fledged pharmacist. So it was one of those, I didn't know what was going on. But it was just more the fact that I was constantly cold. I was just cold. I don't like cold. I like a holiday because I don't like feeling cold. So it was just the chills and the fever and the muscle ache. With the flu, I think that is, most people who've got COVID will say it's pretty much the same symptoms as what the flu gives, which is what I felt with COVID when I had COVID. So it is that sort of not feeling like yourself, just the constant aches and pains and fever and the chills. That was terrible for me with the flu. Now, having said that, it is very abrupt flu symptoms. That is one of the differences with a common cold. So the symptoms, literally like that, very similar to COVID symptoms. One night you could go to bed, you're just feeling a little bit not like yourself. You wake up the next morning and you cannot move. It is how abrupt the symptoms of both flu and COVID can be. Whereas with a cold, it is a little bit gradual. So it's just you start getting maybe a bit of a runny nose, and then you start getting a bit of a coughing. So it is gradual symptoms, whereas of course cold, flu and COVID are both very abrupt. So that's also one thing I don't like, that one minute you're okay, the next minute you're calling your dad, asking, giving them your dying wish. That's terrible. But also it's the fever. You get fever with flu and COVID, or you can get fever. Now I say you do, but you actually can, or you can get away with not having a fever, and it's not the nicest thing having a fever. So that also comes in place with sort of like aches and the pains, and also just the fatigue. The fatigue with flu and COVID is excess, and you just don't want to do nothing. You want to stay in bed, not Netflixing, stay in bed and resting. It takes away from everything. So you can most certainly tell the difference between a flu and a cold, because a cold, you'll still go to work, you'll still manage to do day activities. Whereas when you hit with a flu, it's like you've been run over by a bus that's carrying 20 kids that's shouting. It is very, very, as Steph said, it is very, very extreme, some of the symptoms. Now, symptoms of cold and flu are similar, but of course we both know that the flu can be a little bit more aggressive. But how do you then prevent the flu?
I think that's a very important question. It's something that people need to know. So with cold and flu, they are transmitted it's like a respiratory disease, and you can get it through like your environment, to the air. If you touch someone, you can probably if that's how it spreads. So like hugging someone, shaking their hands, when someone sneezes and they don't cover their mouth, it spreads. So to prevent you from like getting a cold, you need to basically practice some hygienic things. So make sure you wash your hands regularly. You come back from work, wash your hands. You go to work, wash your hands, like before you eat, before you touch your face. Like avoid touching your face very regularly. Like as women, I think we tend to do it very often. You might sweep your hair off your face, touch your nose, rub your nose. Try and avoid that. Be more conscious, in avoiding those things, because that's how you the virus spreads. Not to be gross, but the cold and flu also spread through saliva. So let's say, for instance, kissing, you may contract the cold from it. So if someone has a cold, please, like your husband, your spouse, your husband, that sort of thing, please, let them recover before you get back to business. So make sure you avoid that. As I said, also hugging, coming in contact skin to skin, that can also, put you at risk of like contracting a cold. So try and avoid that. If you know that someone has got a cold, please do not like shake their hands, do not hug them. If you also have a cold, try and avoid that skin to skin contact. When you do also have a cold, when you blow in your nose, make sure you use a tissue, dispose of that tissue in the bin, wash your hands after. When you do sneeze, make sure you catch it with a tissue and dispose of it, so that it doesn't go in the air and cause someone to get a cold. So those are simple things we can do to help reduce getting a cold. I mean, the cold season is so common, and some people say the cold actually gives them the cold, but no, it's not the weather that gives you the cold, it's the virus and the environment that gives you the cold. So if you practice these common measures, hopefully that should reduce your risk of catching a cold. Trudy, so what would you advise someone who has a cold? What can they do? What can they take? What would be your advice for someone?
Right. So you can ease cold symptoms normally by resting. Cold symptoms are, as we said, caused by different viruses to the flu or COVID virus. Now, with the way that the cold works, you can literally just drink plenty of water. Normally things like decongestants will help with some of the symptoms, like the stuffy nose and all of this. But of course, this is not suitable for everyone. So if you have young children, you cannot give them things like decongestants. And of course, painkillers, when you start having a bit of the other symptoms, like you're not quite yourself, you're feeling a little bit achy, which is more common with the flu as opposed to the cold. But, you can still get that with a cold. You can't have things like painkillers. And of course, as you said, Stephanie, keeping warm is very, very important, because as much as the cold is not caused by the cold, most of these viruses really love cold weather. They thrive better. They are supposed to mutate better in the cold weather. So keeping warm is very, very important. Personally, I always advise my patients to drink plenty of orange juice, eat plenty of oranges, because there is a lot of vitamin C in oranges. And also, just for a sore throat, honestly, gargling salt water can actually soothe a sore throat. So you don't need to go to the doctor to get antiseptic spray. If it's just a minor sort of sore throat, there's home remedies that can help with that. So literally, warm salt water, gargle that every now and then during the day when you're out and about, when you're home, and that will really help with a cold, with a sore throat, as opposed to constantly using medication. Now, as much as we are pharmacists, i.e., we deal with drugs, not literally, we personally, I don't like people depending too much on medication, because your immune system should normally be able to fight a lot of these things. So if you give your immune system the chance and just using medication when needed, then of course your immune system will be able to fight some of this some of these symptoms. So literally gargling water when you have a sore throat, unless of course it's very extreme, will help get rid of the sore throat. Now there is also cold and cough remedies. So depending on what kind of cough you have, there is remedies over the counter. You can speak to a pharmacist depending on the cough that you have. Sometimes people do confuse the kind of cough they have. You know, I've had a lot of patients come into pharmacy and, you know, I ask them, oh, what kind of cough you have? You know, sometimes they go, and I'm thinking, I don't know what cough that is. You know, you need to tell me, is it chesty? Is it dry? Is it tickly? Because
Yeah.
there's different ingredients in all cough medication that helps tackle different coughs. Now, there's an ingredient called guaifenesin, which will help. It's an expectorant, so it will help with that sort of like phlegmy, mucousy, chesty cough that you're trying to cough out, and you can't quite break it, and it's keeping you awake at night because you're trying to cough it out. When you lie down, you can feel it right there. So as I said, there is different remedies for different types of coughs. So best thing normally would be, if you have a cough that has been going on for a while. I'm not talking about cough, you know, you sprayed something and you're like, oh, I've got a bit of a cough. No, a cough that is caused by a common cold has been going on for a while. You can't shift it. And you've tried, again, there's things like home remedies, like, you know, just something to lubricate the throat. Sometimes if it's a tickly cough, you know, a little bit of honey, a little bit of, you know, just even the water, that will help relieve that. But if you've tried some of this and it's not shifting, go to the pharmacy, speak to the pharmacist. They will have the knowledge to advise you enough on what is best for your specific cough. And what you have to be careful though is not to use both paracetamol or ibuprofen on top of some of the cold and cough medication, only because what happens is a lot of this medication will also contain some of these products. So you have to be very careful. And whenever you go to the pharmacy to get your cold and also your flu medication, make sure you tell the pharmacist all the medication you're on, just so you're put on, or you're given the right medication that is not going to maybe interact with medications that you're on, or is not going to be an overdose to medication you're on. Now the COVID virus, which is what we've all been talking about the last few years. Stephanie, what makes the COVID slightly different from, say, cold and flu, and what is the remedies with it?
With the COVID-19, as we mentioned, it is a different virus. And with the COVID-19, so what made it scary is that it's got very similar symptoms to the cold and flu infection. So you have like the nasal decongestion, you have the runny nose, the sneeze, and all of those symptoms. But then it came with other additional symptoms like losing your sense of smell, your sense of taste. You still get like the body aches, but then you also have the more serious effect where it affects your lungs and you can't really breathe very well. And the COVID-19 also was spreading very quickly, you know, and is more aggressive as well. So some people have mild symptoms, others have like severe symptoms. And that is that when you do have COVID, just make sure that you Well, if you have those symptoms, just make sure that you go for a COVID test just to rule that out. If you, just to rule it out, if you don't have a cold, if you don't have the COVID, at least you know that it's just like a common cold or it's just a flu. So it's quite important to get a test done. With the COVID-19, I think we all remember the lockdown. It was very scary. Like, you know, we had a lot of deaths and stuff, and that's because they didn't know, like, the structure of that virus was just very strange to the common cold, and they couldn't come up with like a vaccine. But now they do have the vaccine, which there've been multiple multiple variations of it, you know. With the COVID-19, personally, I don't think I've had it. I may have had it, but I was very stubborn. I didn't actually want to want to know whether I had it or not. I did have some common symptoms, and I was just afraid at that time to test it. But then, luckily enough, my symptoms went away. But please do not be like me. If you have those symptoms, please do go test it just to rule it out. You don't want your symptoms to progress and make matters worse. So if you have any like respiratory symptoms, please try and get a COVID test, okay? Just to rule it out. With what I sometimes do, like when I have these symptoms, I usually chew on onions. Trudy, I don't know if you've heard of this, but I chew on onions, and apparently onions have got like anti-inflammatories and an antioxidant in it, and it actually helps me. I'm not gonna lie. Or you may have like a few like smelly breath here and there, but make sure you brush your teeth. But it is so good, as in it really helps with my symptoms. It takes away all the runny nose, and then I feel better in like a couple of days. So I even give my kids like I give my kids some onions to chew on, and then sometimes I soak it in honey, just to lubricate, you know, my throat. Sometimes I've been coughing too much, and believe me or not, it really helps me. It really helps me. So anytime I've had like all these symptoms and I fear it may be COVID or it may be a cold or flu, just have a little little onion soaked in soaked in honey, and it really does help.
You
Um,
are braver than me,
with
Steph.
Trudy, have you had COVID-19 before? I'm not sure if you have. But
I
I
have had
haven't.
COVID. I have had COVID.
Oh, okay.
Yes, I tested for COVID on Christmas Day of 2021. Yes, on Christmas
Oh
Day, uh,
no.
you know, day before Christmas, Christmas Eve, I was at my dad's with my sister. We watched a movie, and we were supposed to go out on Christmas Day. Actually, I think we're going to either my sister's, I can't remember, but one of our relatives was hosting us for Christmas. And I was like,
Mm,
great, we don't have to cook. This is good. So went to my dad's on Christmas Eve. You know, as you do, we watched a movie with my sister, we had our popcorn. I was feeling slightly ill, but I wasn't. I just thought, you know what,
mm,
I've probably had, like, I've worked too hard this week. You know, it was week before Christmas. It's always crazy in the pharmacy. So I thought it's possibly just one of those. I went to mine. I, you know, got ready for bed, went to bed. Next morning, Christmas Day, I wake up and I'm like, wow, I feel really rough. And we didn't have anything, you know, it wasn't like, oh, you know, Christmas Eve, we had a little bit to drink. No, we only had popcorn. So I was like, no, this is a lot. This is quite bad. Anyway, I got ready, went to my dad's, and he said to me, you know, and I did say to him, Dad, I feel very rough. I was like, have you tested for COVID? Because I tested last night, because when I wasn't feeling well, I did test. And guess what? It turned out positive. So I had to go back to mine, and I spent Christmas Day in bed on my own. So yes, I have tested for COVID. Now, it's
um,
very important. You did say a point, Stephanie, about the whole testing. You know, some people don't test, or some people just
yeah,
don't want to test. That's my mother, and that is you, Stephanie. And I respect
that's
your
me.
decisions. It's okay. But just to advise you, if you get if you get a negative COVID test, and you're okay, or you have the symptoms but you feel like you're okay, it is important that you maybe test again, because what that could mean is that during the time that you collected this sample, that you weren't quite exposed to the virus, you know, if it's COVID, or you weren't, there was not enough in that sample to pick up as COVID, because it's the way the viruses work is with time it will pick up in a sample, you know, with mutation and all of that. So testing negative for COVID doesn't mean you're not infected. It could mean that your infection is just sort of like incubating. Your virus is just, you know, all of this is incubating. So it is very important that if you test negative for COVID, but you have all these symptoms, you're feeling not like yourself, you feel like you've been run over, you know, you're feeling very rough, and you have all the COVID symptoms, it's important to test again, maybe in the next 12 hours, maybe in the next 24 hours, just to rule out COVID completely. And one very important thing I would say is getting vaccinated helps prevent, I suppose, future both COVID and flu viruses. Now, we will hopefully talk about the vaccinations in our future episodes.
Trudy, before we go, I wanted to ask you something. So I came across this thing. Actually, I've known that for a while because my dad does it, but I wanted to find out your opinion about it. So my dad used to use TCP to gargle when he had when he has a cold, and I thought that was really strange. But then I also heard some old people, like some old patients, they were saying, yes, when I have a cold or like a sore throat, I gargle with TCP solution. I'm like, wow, I've not heard this before. Well, like, apart from my dad, which I thought he was strange, like, I've not really come across other people doing that. And then when these old patients said it, I was like, wow, so this is actually a common practice that people do.
Yes.
So have you come across it before? What are your thoughts on it?
My thoughts is people like this are brave. It's either you have, some skills in life, you either have it or you don't. Gargling TCP is a skill. You either have it or you don't. I do not understand how anyone can, like, if it works for you, go for it. It's a traditional remedy that has clearly the older generation know what they're doing when they're testing out some of these things. But no, you will not catch me in my deathbed gargling TCP. No, it's just the smell of TCP is so strong. Just imagining that I have to gargle it. And do you know what? You're right. A lot of my older patients, they come in like, you got any TCP? I'm like, no, but we've got other antiseptic. Yeah. And they're like, no, I want TCP. I need to gargle it for my, you want to what?
Yeah.
Wow. It is, if it works for you, you go for it. Some of these traditional ways, these people who've been doing this for years and it works for them, but it's not for me. No, it's not for me. Steph, the same way onion is not for me. I cannot have onion in a salad. Why am I going to chew onion?
Listen, I even forgot to mention onion and ginger. Like these
ginger,
two
yes.
with honey. I'm telling you, they make the best cold and flu mixture. Like sometimes I make like a solution out of it, and it works like magic. I'm not even exaggerating. See, it works
ginger
like magic.
And lemon I will have. I feel like ginger and lemon works for me.
Lemon,
but onion,
I forgot about
no. Like I honestly genuinely cannot have onion in a salad. If you give me a salad with onions, take it back. Take the onions out of my salad. Give me back the salad. It's just the smell of it. As soon as it comes close to my mouth, no, I don't want
the smell, but
I am glad it works for you, Stephanie. I really admire your bravery. You've done well for yourself with the onion remedy.
Yeah, no, do you know what? Yeah, I know I'm a pharmacist, yeah, but before I take like a tablet or a medicine, I want to try like a home remedy first before I move on to like the tab like the conventional the conventional medications. Like I really do like home remedies. Like it works for me. It works for me. And try it. You never
No,
know. You
home
never
remedies are
know.
good. Now, I am here for home remedies, but there's some home remedies that will not touch the tip of my tongue. Onion and TCP are out of there. Anything else, give me. I will chew your garlic. I will chew your ginger. But literally anything else is not going to work for me. But that's great though. That's great.
Yeah.
It is this has been very, very educational, knowing that there's anti-inflammatories in onions. So maybe if I caramelize my onions, I'll know that I am doing something good for my gut. But I will not have them raw. But thank you, Stephanie, for letting us in on some of this. It has been educational.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.